This is Mrs. Palmer-Quay with the third video for Unit 12. In this video, I will be talking about some disorders that occur in our immune systems. First, let's talk about organ transplants, which is not exactly a disorder, but there can be repercussions. There are 4 ways that you can have tissue transplanted, or 4 different levels of tissue transplanting. The first one is when you provide tissue for yourself. That's known as an autograft. So if you have a large injury to your skin, a burn, or perhaps skin cancer that needs to be removed, you may be supplying a skin graft from another part of your body. So there obviously is no problem matching and compatibility if you are having an autograft in transplants. An isograft is if you have an identical twin who's able to supply whatever tissue is needed. An allograft, which is really what we're going to be talking about in this particular video, is when you have an unrelated individual supplying the tissue or the organ for a transplant. And then there are a few cases where you have a xenograft, where another species supplies the tissue. I know someone who just had the mitral valve replaced in his heart last year, and his valve came from a pig, so we are still doing that. This picture over here shows you some of the places that we are using organ and tissue transplants. These may come from donors that are still alive. Kidney transplants are often someone donates for a member of their family, because we do have 2 kidneys and you can survive with just 1, so that may be a living donor, but oftentimes organ donations come from someone who has suffered brain death while the body is still able to be kept alive. So on your driver's license you can choose to become an organ donor, and I certainly encourage you to think about that, because there are many ways that your body can be used. If you should happen to die while you are in good health, someone else can have their life extended by your gift. In organ donation, we have to have tissue matching. Just like we do blood typing to match blood before transfusions, the various antigens on white blood cells, the human leukocyte antigens, are evaluated, and they've discovered that there are 6 that are really critical in having a good match in organ transplants, so those 6 HLAs are considered. The closer a match, and if you've got 5 out of the 6 matching between the donor and the recipient, then your chances of having a successful transplant without rejection occurring quickly are much better. But there's still, it's not completely understood all of the factors that go into rejection of organ transplants, and so even a high level of match sometimes is not successful. Of course, what's happening in the organ transplant is that this tissue is being recognized as something foreign, not self, and so the body responds as if the transplanted organ is a pathogen. This chart down below shows that over time there is a decreased number of transplanted organs that survive. There's just sort of a steady downward. We have this initial drop. There can be an acute transplant rejection that can happen within just a few days of the organ being transplanted. The body just completely refuses to allow this piece of foreign tissue in. But in most cases, because of the matching situation, it's more of a gradual buildup. There's a chronic rejection, a chronic state of inflammation that is always attacking these organs, and it just gets to a point that the transplanted organ is no longer able to function. To delay that as long as possible, doctors prescribe immunosuppressive drugs, which are used to decrease the response of activated cells, to keep activated T cells and B cells from dividing and ramping up the immune response. But as a result, then the person is at risk from other infectious agents because their immune system has been suppressed. So it really is a trade-off. Your life is extended by the transplant, but you have to be very careful about your exposure to other potential infectious agents. I know someone whose husband is a kidney transplant patient, and if she comes and visits me at my farm, she's got to be very careful about cleaning herself up thoroughly before she does any contacting, any touching with her husband, because he is susceptible, and we don't want to spread any of the many germs that I have at the farm and farm animals back to him. I found this interesting graphic that talks about a technique that is being tested and investigated for preventing organ rejection when you have a live donor. So this is a kidney donor situation where someone has donated a kidney, and at this, along with the kidney, we have stem cells being provided by the donor. The the bone marrow has been treated through chemotherapy to be repressed. The recipient's own immune system has been greatly compromised. It's one of these situations where they'd be living in a very sterile environment in the hospital. So their immune system is kind of knocked out, and the donor stem cells are injected into the person along with the kidney. And so what happens is that these stem cells then would recognize the kidney as being self, and for whatever reason, they also don't recognize the body of the entire person they're now inhabiting as anything foreign. And so they've had success with a system that allows a person to go off immunosuppressants because their immune system is not seeing this donated kidney. So this is something that's pretty new, and is, it's limited because you have to have a live donor, and they're still trying to figure out a way to do it when you have a donation from a cadaver. Next, I want to talk about immunodeficiencies, deficiencies in the immune system itself. There are two levels. There are primary immunodeficiencies and secondary immunodeficiencies. So in primary immunodeficiencies, you have a genetic disorder that's causing the problem. Something is wrong with the genes. A protein is not made correctly so that the immune system does not have all of its components functioning correctly. There is a continuum. Immunodeficiencies may be very mild or can be extremely severe. Most severe cases are typically diagnosed when someone is still an infant, and because if they're not picked up early, there's just no hope of this person surviving. Someone who has a mild immunodeficiency may go undiagnosed for years because they're just more susceptible to getting sick. And so that doesn't seem like a real illness. It's just sort of something you have to live with. Depending upon which part of the immune system is affected, you have different kinds of things that you're more susceptible to. So if somebody is lacking in immunoglobulin, something on the B cell side of things is compromised, then bacterial infections and fungal infections are going to be the thing that plague them. If someone is having problems with their T cell production, something's not working in one of those levels, then the viruses are the things that are going to be the most common infectious agents that are going to give them trouble. You may have heard of the boy in a plastic bubble. This was based on a person from the 1970s who was born and lived his 12 years of his life in a very, very sterile environment while they were trying to get a bone marrow match to allow him to develop a functioning immune system, which did not succeed. But this person that has essentially no immune system because both T cells and B cells are affected is this sudden combined immunodeficiency disorder called SCID. The most common form is an X-linked disorder, so it's known as X-SCID. It's a recessive on the X chromosome, so it is carried by the mother but then inherited by the sons, just like color blindness and hemophilia, some of those other X-linked disorders. Since the person does not have any immune system function or very, very little immune system function, it needs to be treated by giving an immune system. So immunoglobulin injections can be given intravenously. A port can be set up in the body to inject those a little bit more easily. And the ultimate cure, of course, would provide a bone marrow transplant that would provide the cells, the functioning cells present in the body. Right now, gene therapy trials are underway to try to find a solution that may work a little more easily. The problem with bone marrow transplants is that is an organ being transplanted, and so all the matching issues that you have with any other organ transplant also apply on bone marrow transplants. A more common immunodeficiency, and one that is not quite so disastrous so far as a person's survival, is what is known as variable immunodeficiency disorder. Somehow I lost a word in here. It's supposed to be common. I didn't notice that. Common variable immunodeficiency disorder, CVID, and this is a case of hypogammaglobulinemia. Hypo, of course, meaning a low level, and so your immunoglobulin G and usually immunoglobulin A and IgM is also involved, all the levels are too low. So this then is treated by giving injections of these immunoglobulins. And it's very possible for someone to, get regular injections of immunoglobulins and function just fine. The secondary immunodeficiencies are caused by outside environmental factors, things like chemotherapy and having HIV virus in you, or not getting enough of the right nutrition, being on an immunosuppressant drug because of some other condition, being on a glucocorticoid, cortisol, hypocortisone. These are all immunosuppressants we talked a little bit about in the endocrine system, and just generally growing older may cause a secondary immunodeficiencies. So most of the immunodeficiencies are secondary. Most of them are caused by treatment for something else. So it's kind of an unfortunate side effect of somebody having to deal with a particularly acute illness. Hypersensitivities is when your immune system is just a little bit too reactive. So immunodeficiencies, there's not enough of something. Hypersensitivities, too much is going on. I'm sure you're very familiar with type 1, which is the immediate hypersensitivity in which an allergen is treated like an antigen. An allergen is just a harmless substance that the body views as something terrible, a pathogen. Pollen, instead of it just being seen as a ho-hum, it's some pollen in my respiratory tract. Your body goes on red alert and says, here, this is a pathogen, this is something we need to destroy. So an allergic predisposition, which causes hay fever or eczema, hives, all of those sort of things. Someone who has a lot of allergies, the fancy word for that is atopy. So being an allergic person suffering from asthma, or the most extreme form, having experienced anaphylactic reactions, are all type 1 hypersensitivity, because you get an immediate response. The allergen comes into your body and you react. The reactions can be quite mild. You get a little bit of running nose and itchy eyes when it's hay fever season, or it can be fatal if you have a food allergy like a nut allergy or allergy to bee stings. This graphic goes through the procedure for what happens when someone has a bee sting. So it starts over here when the person gets stung by the bee. The venom enters the bloodstream and spreads out throughout the person. The mast cells, one of the immune system cells, have on them the IgE antibody. They are actually connected on the cell membrane of the mast cells. Unlike some of the other antibodies that are free-floating through the fluids of the body, IgEs, one of the places they are found are on these mast cells. And the landing of the antigen on this antibody, on the immunoglobulin E antibody, starts a release of various chemicals into the bloodstream. The mast cells, if you remember, they released histamines. And what histamines do is they cause the capillaries to become leaky, and they cause dilation of blood vessels and constriction of the respiratory system and slowing down of digestive system. And so we've got listed over here on the right some of the things that might happen. If the blood vessels dilate, then blood pressure will drop, which can cause dizziness, seizures, loss of consciousness in extreme case. If you get swelling of the respiratory tract and the soft membranes in the back of the mouth, and you've got constriction of the airways, and so someone is not able to breathe, which can lead down here to wheezing and other asthmatic symptoms when as the passage through the respiratory system becomes compromised. The blood pressure, if it's lowered because the blood vessels have dilated, can then lead to an irregular heartbeat because the blood volume then is going to be affected. As the smooth muscles in the stomach and digestive area contract, just like the muscles contract in the respiratory system, then you can end up with pain and contraction in there. And then itching can also develop as a reaction. So in the worst case scenario, anaphylactic shock, the person will go into circulatory shock because of the changes in the blood volume and the blood pressure, and the constriction of the airways means there's not enough blood gas exchange going on, and so that all of that combines together to being a fatal situation, which is why people carry EpiPens if they are allergic to bee stings. Type 2 hypersensitivity is cytotoxic hypersensitivity, where the antibodies bind to healthy cells, or they bind to cells that are somehow their appearance has been changed by a drug that's being taken or an infection of particular bacteria or virus. So in this case, some of the examples here, hemolytic anemia is caused by a cytotoxic hypersensitivity. It's an autoimmune type of response, Graves' disease as well, and penicillin allergies. The penicillin drug itself can change the cell membrane structure, creating what appears to be a foreign antigen on the surface of the self cells, and so then the body will treat them as so with a type 2 hypersensitivity reaction. Type 3, you have a happens when you have a buildup of the antibody and antigen complexes. You remember the antibodies are sort of a Y shape, and so on each of the top of the Ys there's a place where it can bind to an antibody. So because of that, you can end up having sort of these collections of antibodies and antigens all connected together, which are important because the bigger blobs are easier for the macrophages to eat them. But if it's a tiny blob, and so it's got a few antibodies and antigens connected together, but it's not really enough to be picked up by the macrophages, then these little complexes can travel through the body and cause problems. They typically cause inflammation in localized areas because they kind of go someplace and get stuck. The type 3 hypersensitivity can be triggered by some environmental antigen. There's a condition called farmer's lung, which is triggered by dust from hay, being picked up in the lungs and then causing inflammation in the alveolar area. Or the autoimmune disorders of lupus and rheumatoid arthritis are also involved in a part of their symptoms are caused because of a type 3 reaction. So type 1, 2, and 3 hypersensitivities all involve antibodies, so it all involve your B cells. Type 4 is a delayed hypersensitivity that is a cell-mediated response, so it involves the T cells. And this is a reaction that happens over several days, why it's called delayed hypersensitivity. So poison ivy is an example of a cell-mediated response where your T cells are getting involved and they're just overreacting. Poison ivy, if you don't know what it looks like, here's a picture of poison ivy. And there's just the oil that is part of the plant that you pick up when you brush against the leaf is what then sinks into your skin and causes this reaction with the T cells. But it takes time. It takes several days for it to develop, unlike the type 1 allergic reaction, which is much more immediate. Along with the skin reactions of contact dermatitis, other autoimmune diseases such as diabetes mellitus type 1, where the islet cells in the pancreas are destroyed, or multiple sclerosis, or again another part of rheumatoid arthritis, are all because of this type 4 delayed hypersensitivity reaction. And then on to autoimmune disorders. In this case, that your body sees itself as a foreign cell. So down here we have an illustration where the antibodies are normally would be attacking this bacteria and attaching onto it so to identify this as something that needs to be devoured by a macrophage. But instead these antibodies are also putting themselves on the cell, the healthy cell of the body tissues, and then of course those would be attacked by the immune system. And so in autoimmune disease, there we right now know about 80 different types, and I'm sure there's more out there because we're really just beginning to understand. There may be a genetic component. Most likely it looks like there's a genetic susceptibility. You may be susceptible to developing an autoimmune disease, but you need some kind of trigger to happen. So you might need an exposure to a toxic chemical or infected by a particular bacteria or virus or not get enough of a particular nutrient. And those things all work with your genetic susceptibility to cause you to have an autoimmune disease. Autoimmune diseases are found throughout the body. I'm not going to go through this entire chart, but you can pause the video and just kind of look through all of the different diseases that have an autoimmune component. so that this is the type of treatment for an autoimmune disease, as you might predict, is that a person normally is then put on an immunosuppressant, which again has its own complications and side effects because it just would tone down the immune system, perhaps to the point that other infectious agents become a problem. But at this point, we don't really have any other way to treat an autoimmune disease other than treating the surface symptoms and trying to keep the immune system sort of on a low level so that it doesn't overpower the body tissues. And then finally, what are the effects of aging? Well, just like in every other body system, your immune system slows down and gets less effective as you age. Autoimmune disorders become more common. Everything responds less quickly. There are fewer white blood cells overall, so there are fewer macrophages and fewer T cells and fewer B cells. Older persons also have smaller amounts of the complement proteins, which remember work and part of the system, work together with your other immune cells, and they don't produce as much in response to the bacterial infection. So the cells do not respond as quickly. We don't produce as much of the various assisted proteins and antibodies and such as you age, so that overall your immune system is just not able to be as effective. So this is probably why that infectious diseases are much more deadly as we age. Pneumonia can be quite deadly to an older person, and even the vaccines that are used, the flu vaccines and such, are less effective as you age, just because the body itself no longer has the kind of responding ability that it did when it was younger. It's just not able to ramp up to fight off the pathogens. So this finishes this last video for this immune system. You've got your learning targets and stuff to do, so get working.